Over 14 million people have died from pesticide self-poisoning since the 1960s. It's a crisis concentrated in rural, low-income communities of Asia and Africa, where highly toxic pesticides are easily accessible.
Exactly. So 30 years ago, in a ward just like this, in this hospital, is when I first saw pesticide poisoning, the kind of thing that transformed my life. And people were dying, so many people were dying. Children were dying, adults were dying. We had no treatments, we had no antidotes. And it really changed my life, because the next 30 years, we've tried to find solutions to stop people dying from pesticide poisoning. My name is Michael Eddleston. I'm Professor of Clinical Toxicology at the University of Edinburgh. And that means I study how to treat people who get poisoned. And fundamentally, we try and stop people dying from poisoning. In 1995, I came to Anuradhapura as part of a project to work on snakebite from the University of Oxford with my mentor, David Worrell. Unfortunately, or fortunately at the time, there wasn't many snakebites. And so we spent time on the wards looking at the other problems. And what was immediately obvious to me, that pesticide and plant poisoning was the major problem in the wards. The doctors came up to me and said, solve poisoning, snakebite's not really a problem. And that started my career focusing on that problem. So when I arrived by bus, the first thing I remember is seeing the tank, and across the tank the three beautiful stupas of Anuradhapura. So you're constantly reminded of the agricultural practices which result in people having easy access to pesticides, which result in poisoning. And a culture had grown up during the 1960s and the Green Revolution of having pesticides used in agriculture, stored in people's houses, and they were extremely toxic. Now, some of them, 4-8 for example, is as toxic as a sarin nerve agent. These are compounds which could never have been used safely in people's houses. But they were stored there, and at moments of stress, people grabbed them, drank them. Irangani, Paradeep's wife, shared her story in the hope that it would help someone like her. She said she didn't think they'd had a big argument, but it was too late to save him, because the pesticide he consumed was a lethal one. So it's really chilling every time I come here and see this. Why did you start it? What made you do that?
So basically, started like 5 years before. I was thinking about how to improve the surveillance system, how to exactly identify the exact pesticides ingested by the person. So all these bottles actually fatal cases as well as non-fatal cases. So you can see the study IDs. And
so every bottle is a single person?
Single person, yes.
And they or their family brought the bottle into hospital?
Exactly.
And you got it. And the real reason is to work out exactly what pesticide people are taking.
So this is the Pradeep's bottle.
The library is useful because it tells us which are the common problems, the common products here. We know there's 2 or 3 here which are particularly problematic, which we currently talk with the regulators here about. What evidence do they need to find alternatives for these particular compounds? So it's a chilling place to go. Suicide by pesticide ingestion remains a major problem, with an estimated 150,000 deaths annually, most in low and middle income countries. Each year, about 385 million people suffer accidental pesticide poisoning worldwide, causing around 11,000 deaths. We recruited 225,000 people, 56,000 households, and we gave out 20 to 22,000 storage boxes to half of those households. And we asked, does giving these boxes stop people self-harming with pesticides? And the answer, absolutely clearly, is no. This is not a way of doing things. I asked people, my audiences, how many people put their clothes away every night? Who actually would put their pesticide away every single day? I also remember a photograph that was given to me by Manjula of a young girl around 12 years old, kneeling in front of a box, locking the pesticides away. And her job every night was to go off and hide that key to make sure her father didn't find the key, didn't find the pesticides and didn't drink them. And clearly what was obvious is if she'd done it badly, he'd found the key and drank the pesticide and died, she'd been blamed for the rest of her life. And that's not a fair way of living. That's not appropriate to force people to say, these are really lethal compounds, but you have to take responsibility for them. That's wrong.
just finished a huge study and we worked on 2.3 million population. We trained 1,500 pesticide vendors and that didn't work either. So unfortunately, training pesticide vendors to stop sales to people at risk didn't work. What does work is banning pesticides, simply removing the most toxic pesticides in communities. If all pesticides were not toxic to humans, it wouldn't matter if people drank them at moments of stress. And we also know that some pesticides, which are perfectly effective, don't harm humans.
කට්ටිය බොනවා බීලා නැති වෙනවා මැරෙනවා දැකලා තියෙනවා තව. ඒ නිසා බිව්වා ඉතින් තිබිලා බොන්න හිතුණා බිව්වා. පොයක් දවසට 20 දවස් 2022 පොසොන් පොයක් දවසට.
ළමා ගැන හිතුවේ නැද්ද?
නෑ ඉතින් ගෙදර ප්‍රශ්නත් වැඩි මොකුත් කල්පනා වුණේ නැහැ.
So pesticide companies and others have bought into the myth that if the person didn't die from pesticide poisoning, they would die from something else. And the data clearly shows that's not the truth. That actually it's the toxicity of these compounds and their easy access that has driven the suicide rate globally massively. Therefore, industry doesn't think that removing their products will make a huge difference for suicide. But that's not right according to the data. They also say on the label, don't drink. So there's an argument. The label says don't drink. They push this idea of misuse. In 2017, a colleague and I, Leah Uchesheva, set up an organisation called the Centre for Pesticide Suicide Prevention. And what this aims to do is support pesticide regulators worldwide to get the evidence that they need to make the decisions they want to make about which pesticides should be used in their communities. We know that some pesticides are really toxic and simply cannot be used in communities, others are much less toxic. There's a general background document which classifies pesticides by toxicity. The worst ones are class 1, the safer ones are class 4 and unclassified. So it's quite clear looking at rats, how toxic these pesticides are for rats, you get some sense that these are really toxic and some are non-so-toxic. And what's really happened globally now is almost all the class 1s, the more toxic ones, have been removed from agriculture. So we've looked in multiple countries, Sri Lanka, India, South Korea, Bangladesh, and wherever we've looked at multiple crops, we've never found a reduction in output that relates to any regulatory activity. But actually what's much more important is look locally in the country itself to find out what is the problem. And that's done in two ways, working with doctors in hospitals, like when we came to Anuradhapura Hospital. Anywhere we work with the hospitals, and we work with the forensic toxicology departments. Because people who pass away after ingesting pesticides normally have a medical legal post-mortem and their stomach contents are analysed or their blood, and that can identify the pesticide. When my colleague Andrew Dawson came from Sydney, it expanded to even more hospitals. So we've ended up training 150, 200, maybe 250 doctors across the island in management of organophosphorus and other pesticide poisoning. And the nice thing is now seeing them across the country. We meet them as we walk through hospitals. I've been privileged to work with researchers, with doctors, with nurses, with policymakers. The decisions they make have made all the difference. They provided data to the regulators have gone ahead and regulated. As a result of that, many, many lives have been saved. I've been extremely privileged to work with them, and anything I can do to make that system work makes me happy. I've walked on the wards in Anuradhapura. I've seen those patients. I've tried multiple ways of stopping them dying. I've tried to improve their treatment. I've tried to improve how people use pesticides in communities. Neither of those work. What works is pesticide regulation. It's making sure the pesticides available in the community are not highly toxic to humans. And that means when people do drink pesticides at a moment of stress, they don't die. That's the fundamental message of the work we do. My name is Michael Eddleston. I'm the Professor of Clinical Toxicology at the University of Edinburgh. I work on pesticide suicides globally.